Dr. Aaron Motsoaledi, from the national department's point of view, you are the one who obviously, as the national department, were overseeing the intervention. I would like your overall picture of what has happened.
Well, firstly, we went in to assess exactly what is that needs to be done. Remember, Dr. Mabasa was not yet in at that time.
You came in.
We went in to assess exactly why the department, every department which was under Section 100, the minister was required to do so. And in health, there was a projected over expenditure of 450 million. Remember, in the whole government, there were in the rate for 2.7 billion, but in health it was 450 million. Mm-hmm. So we went in to find out exactly what's going on. Our starting point was to stabilize the finances, Tolani. You know very well that much as our primary objective is to provide healthcare services, good quality, affordable healthcare services, much as that is our prime aim, but you can't do that without finances. So because there was a problem with finances, we started by stabilizing them, looking at the supply chain management, putting up austerity measures, finding out exactly what went wrong and how it needs to be corrected. And I can confidently say we are on track now. We've picked up all those problems. On Monday, I called all the CEOs of hospitals, clinic managers, hospital managers, after meeting with Dr. Mabasa for a whole hour and after meeting for 1.5 hours with his top management. We then met those who are running facilities. Then thereafter, we ended up with a press conference to announce all the findings and all the steps.
And let's talk a little bit about the findings that you announced, because you said, well, this financial situation may be turning around, but there are very serious problems on the ground. And I'm going to start with the issue of the x-rays that you said there's a meeting about next week, Wednesday. One of the issues that you raised was the issue of the x-rays. That has been going on for a very long time. Talk to me about why this issue has not been addressed up until now.
The issue of x-rays?
Yes.
Well, it's because we're getting sporadic reports, even from top managers. In August, I met with all the managers for 8 hours, 8 full hours, to find out what's going on. And it's clear that sometimes it's difficult in a meeting where people report to each other for them to talk bravely and openly about who did that, what. And I could not get the answer. And it was already August. What I did in August, Tolani, there is a COO, Ms. Nova, who has just reported in the National Department of Health as a COO, Chief Operating Officer. We then agreed that we leave her in Limpopo, not to report here at the National Office. Go hospital by hospital, sit with everybody, find out exactly what has happened. She said she met with managers, clinical managers, CEOs, nursing managers, and even then it was difficult until she met people one by one. Get a small office, meet them one by one. The finance manager, procurement manager, clinical manager, administrative manager, go to the gate, meet security, go to the kitchen, go to the pharmacy, meet ordinary workers. Only then is then that all the problems and their nature came out. And that's exactly what we were discussing on Monday and what we put in the press conference.
Right, let me come back then to Dr. Mabasa. Dr. Mabasa, there's an issue of x-rays that Dr. Motsoaledi said there's going to be a meeting about next week. And the reason why I'm raising it is because there was such a comprehensive article that was written in one of the newspapers. In fact, it was the Mail and Guardian around August this year. And it dates these problems to something like March at the beginning of this year. These problems have been there. In fact, some of them date back to almost 2 years ago, and they are still there. And the question about it is whether or not this turnaround has actually done anything in terms of changing those things then on the ground, things that affect people on a day-to-day basis.
The issue of x-rays should be put in perspective. And I think if we reduce the problems of Limpopo to x-rays only.
No, that's not what I'm doing. But what I'm doing is I'm picking up one issue of very many issues.
Let me give you what happened. And the minister put it in the press conference just 2 days ago. The issues of x-rays in Limpopo is twofold. There were x-rays that were faulty, that have not been repaired in some hospitals, but there were x-rays that were bought that couldn't be used, even when they were new, because they were not bought from they were not accredited by the radiation board, control board. So what happened is those were many, and the minister alluded to it. They were bought by many hospitals, but they were sealed because the radiation oncology board is of the view that if an equipment is bought from another country, it must go through some tests in this country to be approved to be used. So that's why we had problems. So you find that the hospitals had X-ray machines, but they couldn't switch them on because they were not approved by the radiation oncology. But don't forget, and the minister put it that way, that X-ray radiation causes a lot of problems. It can cause abortions, cancer, deformities, and that's why they have to be done. So that was what happened as an error. But as for the faulty ones, there were issues where people were not paid from 2008. Mm-hmm. We found that people were maintaining machines, like particularly in the Wahomo, which was one hospital which was unpopular for faulty X-rays. What we had there was a problem where people did not pay the person who maintains the machines. And of course, another area of concern, it was lack of maintenance contracts with the supplier of equipment. Because if you do not have that, and then you invite every neighbor from everywhere to come and repair and you pay them, you will lose it.
Because, but the issue is, these issues, including those, by the way, about licenses, is that they've been going on for such a long time. Why doesn't somebody deal with this thing once and for all?
That's the reason we are there. We have studied that. That's why we found out about that. But if treat a disease, Xolani, diagnose. And the problem is that possibly the diagnostic system that we used couldn't find out what the problem was, because I don't think it should have gone on for this long. In fact, these machines were not bought in March. They were bought 5 years ago. Some of them were bought 4 years ago.
They've been lying there.
They've been lying there
for all these years.
And I knew, yes. So the March issue probably is when people started talking about it. But actually, they were talking about what had happened.
And that is exactly the shame of the situation. Yes. That even with the intervention, we are still talking about the same thing.
Yeah, but it's being done. Well, of course, we should talk about it. And I think that the better that we talk about it, so that we can be able to confront our own challenges.
Let me see if Dr. Ramatuba has any questions. Dr. Ramatuba?
No, thanks, Xolani. What we would like to indicate as SAMA for a start is that last year at this time when you invited us, of course, we were one of the people that were worried. We were not sure whether we'll get our salaries in the first place.
Sure.
And if you remember, at that time, our patients were not having food. As doctors, we were buying food ourselves. So we need to indicate that, at least on that particular tone, we have seen improvement. I'm not worried whether our members will get salaries this December or not. Also, in terms of the perishable, the food for the patient, what happened last year and also during the course of the year, where at some stage we were forced to buy meal for patients and bread, has been clarified by the minister, indicating there's this transversal contract which we never knew about. So, in terms of the what we are trying to indicate here is to say, the role of the administration in Limpopo might be seen as not having assisted, but from our side as medical association, we've seen the benefit of that in that light, that now we don't have to worry about the patient food, we don't have to worry about our salaries. However, having said that, we still have got a myriad of challenges and problems, and the minister has outlined them, many of them, issues of our boilers, our chiller plants, our X-rays machines. These are which we were told for many years that they are capital projects. If I need to be honest with you, Xolani, we used to be told that these are capital projects, you must budget them for 5 years. When you complain that your generator is not really functional now anymore, they will tell you must budget it for the next 3 years or so. But we have seen this week that announcement to say there will be that drastic intervention, and I think that one we do welcome. Yeah. Equally with the pharmaceutical, we that is where a major challenge is that our members face on the ground. To say, you see a patient, you don't know what to even if you prescribe, the pharmacist doesn't know where to dispense that medication from, and you are forced to write private scripts for patients. But what about majority bulk of our patients who are not on medical aid, who are relying on the state for healthcare services?
Sure.
How do you assist those patients? So we are hearing all these positive things from the minister, but our main question as SAMA is to say to the minister, yes, we've seen you overhauling the management of hospitals and also promising that all the COs CEOs that will be appointed, and even those that are in the system will have to undergo through the training. We welcome that fully. But what about the other people who are in management? Because people who are in supply chain, people who are in HRM, people who are in districts here, those are the people who are costing us the challenges that we have. If you complain about the water in a hospital, I don't think that should be blamed on the minister. That should be blamed on that district manager, hospital managers, and the municipality to say, are they working together and understand in case of disaster, what will they do?
Sure.
Now, the problem will not, the minister says all the correct things, and the minister is quite passionate, but the question is he able to duplicate himself and place himself in all these hospitals? What can he do to make sure that he changes the mindset of those of us who are placed in local areas, in clinics, in hospitals, and in districts, to make sure that we carry through what he's saying, the passion that he has, it's being calculated to all of us on the ground. Then you will see us not resolving this problem. The problem is that we are not implementing all what is said correctly.